Hello. Do you have bad acne scars that have bothered you your entire life? They cover your entire face looks quite hollow and empty. You've tried all kinds of treatments. Some of them have worked, but you feel you've reached a level where it's not working anymore. Fat grafting might be the solution for you. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT and Plastic Surgery. And today we'll talk about the 5 dimensions through which facial fat grafting can help improve your acne scars. Now, to begin, what are acne scars? Obviously, when people have very bad acne, these heal, but they leave behind scars. There are multiple different types of acne scars, as you can see here. You can have ice pick scars, you can have box scars, you can have rolling scars, you can have atrophic scars, and these are all the various types of acne scars that can happen. Now, when we look at acne scars, we look at basically 3 things. How big they are, how big is each scar? Second is how many are there? Are there a few scars? Are there a lot of them? Thirdly, how deep they are, what are the depth? So these are the ways that we're looking at analyzing and treating acne scars. Now, what are the traditional treatments for acne scars? The mainstay of treatments is lasers. What lasers do is they make small holes in the acne scar and stimulate new skin production. The skin in your acne scar is old, unenergetic skin. New skin that is produced is more youthful, more soft, more tender, and more like your normal skin. So that's how lasers and other energy-based treatments work. Along with this, there are various regenerative treatments, such as PRP. What PRP does is it again helps stimulate new cell growth. Now these things, they help improve the color and texture, but they don't do much for the depth. So to treat the depth, treatments include subcision, which is where you release the scar and allow it to come up. The other treatment is using fillers, where you fill the area under the scar to fill it up. So this way you can see there are multiple different treatment options for acne scars, and nothing against them. They're all very good. They all have their place. They all have their role. But fat grafting is unique, and we shall see how. So, to understand how fat grafting is unique, we need to understand how it is done. In fat grafting, it's done under local anesthesia. We suck out some fat from your tummy in a syringe and we inject that where we need it. Now, we inject this in 5 different ways. That's why I said there are 5 dimensions to this. We'll go from deep and then go more superficial. At the deepest level, we're putting it on the bone to fill out your face, because people with acne scars, often their cheeks are very sunken in, and putting some deep fat helps to fill out the face. Second, we put some fat just below the scar. So if the scar is tethered like this, we release it with some subcision and then we put some fat below to bring it to flat. So this way we're taking care of the depth of the scar. That is 2. Thirdly, we're putting some fat into the scar itself. We're putting some fat into the scar to puff it out and blow it out. So this also helps improve the height and thickness of the scar, because the skin in that area is thinner. So putting some fat over there will be helping to make the skin a little bit thicker and more even. These 3 were with something called microfat, which is where we're looking at adding volume. We're looking to fill it out. Now we come to nanofat. Nanofat is a derivative of fat that is rich in stem cells, and this helps to stimulate regeneration and new cell growth. So the 4th point is we put nanofat superficially into the scar using a microneedling device. So this microneedling device makes many tiny holes, and this puts this nanofat into the scar, which helps to stimulate new growth. Now 5th is something very unique. We create something called nanofat cream. So the nanofat that we have prepared during the surgery, we make it into a cream and give it to you to take home. And you continue applying that nanofat over your face for a few days after the procedure. So you have 5 levels at which fat grafting is helping. A deep level to fill out the face, a level just below the scar to lift the scar, a level into the scar to puff out the scar, nanofat into the scar to stimulate cell growth, and nanofat cream to keep improving the color and texture even for a few days after the procedure. So this is why this technique is unique, because it does so many different things. In one procedure, you're getting all these different levels of treatment, which typically would require multiple procedures. You would require one procedure for the deep layer, another procedure for the superficial layer. Well, fat grafting can help improve all of that. Now, who is a good candidate for this? The best candidates for this are those with large acne scars which are numerous and filling out a good part of their face. For just 1 or 2 tiny acne scars, other treatments might be a better investment. But for these patients, this is a very, very cost-effective procedure. As I said, it's done under local anesthesia. You come, get it done, go home the same day. There's no admission or anything. There will be a little bit of swelling for around 3-4 days. You feel pretty normal from the next day itself. Those who are working from home can log on the next day itself. By around 4 or 5 days, you can show your face to people and no one comes to know that anything was done. The full results of this procedure takes almost 3 months. In these 3 months, 2 things happen. 1, the swelling has to go down. 2, the fat has to get blood supply. 3, the nanofat stem cells have to work. So this process is what takes 3 months to completely happen. So at the end of 3 months is when you have the final result. Now, you might ask, are there any complications of this procedure? This is a very, very safe procedure provided it is done correctly. The biggest issue is fat survival. How much fat survives depends on person to person and also depends on how the fat grafting is done. If it is not done well and you put large pockets of fat without knowing what you're doing, a lot of the fat will die and you won't get much result. So it has to be done by someone who knows what they are doing. Now let us look at some examples of fat grafting for acne scar results and you will see what I am talking about. I hope this video was useful for you. As you can see, fat grafting is a unique tool for treating acne scars. It does multiple things which usually would require multiple different treatments, but you're getting all of that in one treatment. If you'd like to know more about this and see if this is right for you, get in touch with us. Our number is on the screen. Do like and share this video. Do subscribe to our channel. Thank you. Have a great day.